Hi everyone, Maggie Seldeen here with you from High Rockies Harm Reduction here for our first Friday Narcan training and recording this so that we can share it with all of you later. We'll be talking about how to identify an opioid overdose, how to use Narcan, injectable naloxone, and also how to use fentanyl test strips. And as always, I'm accompanied by my fabulous partner in crime, Coreen. Go ahead and give us your introduction.
Hi, everybody. Thanks for tuning in, watching this, making the efforts to educate yourself on how to enable breathing through Narcan. Love you. So I am with an organization called Young People in Recovery, and we just strive to provide recovery support services to those in or seeking recovery from substance use disorder or alcohol. Thank you so much.
Thanks as always, Coreen, for being here. I will go ahead and start sharing my screen and get us on this PowerPoint. And as always, Coreen, feel free to jump in with any tidbits. In the work we do, anecdotal evidence is often more important than the statistics that we get from the state or whatever, because we're talking about criminal behavior and there's a lot of nuances. Every single body is different. And so what works for one person might not work for another one. And one person's experience might not be the same as the other. So it always helps to get as many perspectives on these subjects as we can. So this is my slideshow on preventing, recognizing, and responding to opioid overdoses. This was created by Lindsey, Simbeye, and Jessica Eaddy, who are external strategists for the Western region from the Colorado Consortium for Prescription Drug Abuse Prevention. Their contact info will be at the end, but of course you can always reach out to myself, Lindsey, or Jessica for any questions on this. And special thanks to all of the state and national organizations that helped made this presentation possible. So for community members who come into contact with people at risk for opioid overdose, knowing how to use naloxone and keeping it within reach can save a life. As we'll see throughout this presentation, there are a lot of laws created in Colorado to encourage community members to carry Narcan and know how to use it in response to an opioid overdose, because we are living in a time where really anyone can potentially witness an overdose. If you come into contact with the public at any time in your life, you have the risk of witnessing an overdose. And so today we're going to be talking about the opioid overdose reversing drug naloxone that comes in several forms, the most common of which is on the left of the screen, the Narcan nasal spray, which was approved by the FDA in 2018 and since then has just been widespread used in reversing opioid overdoses by EMS, by police officers, by public health workers, harm reductionists, and just general third-party people witnessing overdoses. But naloxone does also come in an injectable form, which we will talk about today. It comes in both a preloaded needle and also vials for you to load your own needle. And then the Avisio auto injector is an older form. It's no longer made. It has been discontinued. It's like kind of like an AED. It's automated and tells you what to do. They no longer make those, but if you have one, they are still safe to use. And so I always think it's important to first start this conversation by what drugs we're actually talking about and a little introduction to what an opioid actually is. So opioids are drugs that are derived from the opium poppy plant, and they include heroin, which is usually the illicit form of opium that we see, as well as prescription opioids like morphine, codeine, hydrocodone, which is Vicodin or Lorcet, oxycodone, Oxycontin, and all of the brand names associated with that. So basically, painkillers with opium in them. And then fentanyl is an opioid that is actually used in medical pain management, often in the form of patches and lollipops. But as we'll see throughout this presentation, fentanyl is posing a significant threat to our communities as it's also illicitly manufactured and is a white powder that can easily be disguised as other drugs, Carfentanil is also an analog of fentanyl that is even stronger than fentanyl. And we talk about this a lot because it's really posing a specific threat in our drug using communities, because you might not know that you actually have fentanyl or carfentanil in your drugs. And fentanyl is 100 times stronger than morphine, 50 times stronger than heroin, and carfentanil is 100 times stronger than that. So 10,000 times stronger than morphine. We haven't, to the best of my knowledge, seen a lot of carfentanil out here in our rural communities. It's mostly, we're seeing it a lot on the East Coast, but it's still definitely something we want to be aware of, because these drug trends kind of tend to move through the country, right? So opioids, they not only relieve pain, but they have a variety of effects. They cause a sense of euphoria. They can cause sedation or sleepiness, which is really usually more associated with that pain reduction. And when you have that pain reduction, you can fall asleep, not so much that the drugs cause you to be sleepy themselves, but it's kind of a common side effect symptom. They also provide cough suppression, they decrease anxiety, create constipation, and respiratory depression. What's interesting about opioids is they actually do no damage to the organs of the body over time in the way that stimulants like methamphetamine or other substances like alcohol do. They're actually pretty safe to, if you were using them over time, as far as what it's doing to your body. The only real long-term effects of that are constipation and maybe decreased libido, just everything kind of moving a little bit slower. But the risks associated with opioids are more with the fact that it is an extremely addictive drug. It takes the body 2 weeks to become physically dependent to opioids, and the fact that when it's used illegally or through injection drug use, you can have overdoses, you can have wounds that lead to abscesses, lead to infections. And so the drug itself is actually not doing as much harm as a lot of other drugs out there, but it's the fact that it's illegal and the way that it's controlled that creates so many of the problems. And what's fascinating about opioids is that while it has all these different effects, tolerance to these different effects builds up differently. So, for example, people often feel nauseous the first time that they use an opioid, like a pill or heroin, and then that might not happen the next time they use. People often develop a tolerance to the euphoric effects of opioids rather quickly, and it becomes this chasing the dragon situation where you're not taking the drugs to get high, you're just taking the drugs so you don't go into withdrawal, which we'll talk about later, which your body starts to show those signs after 2 weeks of use. And so if anyone's ever had a prescription painkiller, it's usually written for about 2 weeks, which is kind of disturbing and one of the things happening in our medical system that is not quite right. But tolerance to other effects, for example, that respiratory depression, which, as we'll see, is really the cause of overdose deaths from opioids, you might never build up a tolerance to that. So you're using more and more to get the same euphoria or the same pain relief, but your body is still at great risk for overdose. So, what happens in an opioid overdose is our brain has all these receptors in it that naturally take in opioids, because, like with most drugs that are used for psychotropic reasons, our bodies naturally make these pain-killing chemicals like opioids or THC. But when we're using a substance like heroin or oxycontin, we're putting way more of that substance into our body than we can naturally make. And our brains are very adaptable and kind of elastic. It's the muscle. If you don't use it, you lose it. And so when the brain is like flooded with too many opioids, the brain is kind of like, I don't need to have as many receptors because I have way enough of this chemical. And so the more you use, the fewer opioid receptors you have. I might be getting a little bit ahead of myself here, but basically an opioid overdose is when all of your opioid receptors are full and there's still more opioids rolling around in there, and it leads to respiratory depression or your breathing stops. Now, what naloxone does is it is an opioid antagonist. So it has a higher affinity for those opioid receptors. So it comes into that receptor, kicks out whatever's in there, whether it's heroin, methadone, oxycontin, fentanyl, and blocks and binds to that receptor so nothing else can get in. So it's pretty much immediately reversing the effects of that overdose by clearing the opioids out of those receptors. And we'll talk a little bit more about what that looks like, but getting into who is at risk for overdose. So, any patient with an opioid prescription and their household members. About 70 to 80% of people in treatment in Colorado for opioid use disorder started with somebody else's used medication, which is why we do drug takebacks every 6 months. And there's a lot of effort to get out there and make sure that, if these medications aren't being used, that they're out of the house. And if they are being used, they're being kept in a safe location that's not accessible by other household members. And one of my kind of taglines is I think that there should be Narcan in as many American homes as there are opiates, which is most in my experience. Opioids are widely prescribed, and so are benzodiazepines and like Valium, and these are dangerous drugs. So individuals who have a prescription or have access to a prescription are at risk for overdose. So are people who use opioids alone because there's no one there to call 911 in case of an emergency or to give them Narcan in case of an emergency. And so Coreen turned me on to this amazing resource called Never Use Alone. And if you just Google that, you can see there's a hotline phone number for Never Use Alone, where you can call if you are using alone, and they will stay on the phone with you and call 911 if you become unresponsive. So it's an amazing resource. The police are not involved in this. It's super safe, and they've saved a lot of lives already through that program. Because in reality, most people do use alone because they can't tell their family members that they're using heroin, right? Coreen, did you want to add anything?
I do. I wanted to add there's an additional resource called Be Safe, and it is an app that you can download onto your phone. And this Be Safe app is pretty much mirrors Never Use Alone. However, you have the choice to say with the operator that is involved with you, if I don't respond in such and such time, please call my mom, please call 911, please call my neighbor. Or you can really, the basis of that is you can choose who your emergency contact is going to be. So really just trying to break that stigma around the conversation of, why we use alone.
That's great. Thank you so much, Corey. You are just a wealth of resources and knowledge always. And that sounds awesome because I get it, and we'll talk about this more later. A lot of people, there's still a lot of hesitancy and resistance to call 911. And it's just really important to have a resource to keep you alive. We can't save people who aren't alive. The only thing that Narcan or Naloxone enables is breathing. We just want to keep people with us because we know from personal experience that anyone is capable of redemption. No one is a complete lost cause, right? And I know I talk a lot in my community here in Glenwood Springs, Colorado, in the Roaring Fork Valley about reducing the stigma of substance use. And sometimes I get this response like, what does that mean? Are you saying it's okay to use meth or it's okay to inject heroin? Well, a little bit I'm saying that, but mostly what I'm talking about is reducing the stigma so that people can feel comfortable asking for life-saving help. They can feel comfortable going to a doctor and being honest. They can be comfortable going into court and being honest because right now these systems just perpetuate criminal activity because they reinforce that we need to lie about what we're doing, and that just pushes us further into our addictions and use. But that's a speech for another day, but always important to add in here. So other factors that increase the risk of overdose, like with most physical ailments, any depression or psychiatric illness or poor physical health increases your risk of a potential overdose. A history of substance use disorder or a history of prior overdose, because like I said, the more you use, the fewer receptors you have to catch that opioid for you. Injection drug use is a big risk because the drug is getting directly into your bloodstream. So we always encourage people, if you are going to inject, start slow. You can always use more later, but you can't unuse what you've already used. And if this is a possibility for you, maybe consider smoking or orally ingesting your drugs to reduce that risk. So it's getting into your system a little slower and not really flooding out those brain receptors. Drinking alcohol or using any other drugs. And so this is kind of a two-parter. So opioids are a central nervous system depressant. They are depressing your central nervous system and your ability to breathe. Alcohol and benzodiazepines like Valium or Xanax do the exact same thing, and there's no overdose drug for those. So when you're mixing multiple substances that have that same effect, it increases the risk that you will have respiratory depression and stop breathing. Now, alternately with stimulants, sometimes people think, oh, well, I'm using meth with my heroin, so I'm not going to overdose, right? Well, first of all, I don't know what's going on with your body, but I mean, in my experience, a lot of us with addiction issues also have other health problems going on. And like I said at the beginning, every body is different. And I have been seeing a lot of cases this past year where I don't know what the person took necessarily, and they died of a stroke or a heart attack or something like that. And it could absolutely be from these weird combos of street drugs, of maybe there being carfentanil in their meth, or they're mixing meth and heroin and their body, can't take that. And as we talk about a lot in these trainings, the scary thing is when we're using street drugs, we don't always know what that is. And so I also like to, talk about, and this, we're going to kind of go into that subject, but I want to kind of pause to also illustrate what a stimulant overdose looks like versus an opioid overdose. We'll go into exactly what an opioid overdose looks like, but it's basically like someone losing consciousness and they stop breathing. Whereas with a stimulant overdose, it looks more like they're having a heart attack and they get flushed and sweating, red, heart racing kind of thing. But, there are a lot of what ifs happening everywhere in between those things. And 5 years ago, we didn't really know what fentanyl was, but we knew people were dying from hot shots. And so, based on a lot of loss I've had this year, I don't know what drugs you're taking. I don't know what could lead to your stroke. Is it your body or is it these drugs? Because you don't even know what you were taking. So, that leads into how having different strains and sources of drugs is also a big risk factor for overdose because of these purity issues. Because if you have a white powder that someone told you was heroin, it's probably fentanyl. And that white powder can also easily be disguised as meth, as cocaine, as MDMA, and then, as we're seeing so often in our communities, as fake Xanax or even fake blue Percocet. So we're seeing a lot of fentanyl and carfentanil in other drugs, and that's leading to overdose. And so I also have people say terrible things to me like, well, drug addicts make that decision to overdose. They make that decision to use too much. Well, that's not what's happening right now. People are dying accidentally because they think that they took a Percocet, or because they're 14 and they think they took a Xanax, or because they think they're using MDMA and it's actually fentanyl. So it's not anything to do with this person's choice, because they did not make the consensual choice to use the drug that they are inadvertently using. And again, it goes back to how our system controls these drugs, and it's very scary. And then finally, one of the biggest risks for overdose is any recent really period of abstinence. But often we see discharge from hospitals, jails, rehabs, things like that, where a person basically has been sober for an extended period of time. They think that they can go back to using the same amount of the drug that they did before that period of sobriety, but their tolerances have shifted and they no longer can basically take that amount of the drug, and they overdose. Because not only do the tolerances build up kind of uneven, but they also can go away uneven. If you've been sober for 2 months, you might not be able to do 20 cc's like you used to. You might want to start with 2 and see how it goes. I believe that the statistic is about people who are released from jail in the 2 weeks after that release are about 136-ish times more likely to overdose than the general public. So also creating a lot of awareness in our jails, in our hospitals, and with prescribers about giving Narcan to people. And again, I really encourage, it does not matter if they have a history of opiate use, because if they have a history of meth use, they're just as likely to have a fentanyl overdose as somebody with a history of heroin use. All right. So, and then this is just talking a little bit more again about when you're mixing opioids and benzodiazepines, you're 10 times more likely because the drugs have the same effects. And that the majority of overdose victims usually do have multiple drugs in their systems. And that can be both the drugs themselves and the way they interact with your specific body. And again, that there is actually an increased risk of overdose if you combine methamphetamine or cocaine with your opioids. So now we're going to get right down into the dirty of how exactly to identify an opioid overdose. At the end of this training, there will be a lot of great resources. So you don't have to remember all of this today, but this is just kind of a general overview to help you feel confident that you know what to look for. Because the biggest thing with identifying an opioid overdose is this person overdosed or are they just really high? Because it can be really hard to tell with a heroin overdose specifically. So somebody who's overdosed is going to have pinpoint pupils, shallow or slow breathing. One of my favorite resources to prepare people who have never witnessed an overdose before is if you just go on YouTube and look at live PD Narcan, and it'll show you all these different cases of what an opioid overdose looks like. Because sometimes it looks like the person is having a seizure. Sometimes it might sound like they're snoring. And so again, every body is different and it can kind of manifest in different ways, but basically their breathing is irregular or potentially not there at all. They're going to have cool and clammy skin, kind of ashy or pale colored. Their lips and nails might start turning a little blue, which is a sign that they're not getting oxygen. They're unable to talk, not responsive, which is kind of like the key that we'll talk about on the next slide. They've lost consciousness, their body is limp and heavy, and they have a slow heart rate or low blood pressure or potentially no heart rate at all. And so when you're totally unsure, if you can't tell, you're like, oh, I don't know, are they high or are they overdosed? There's what we call the shout, shake, sternum rub method to confirm. Because basically what we're trying to see is this person responsive? Are they with me? And so you want to shake them. You want to shout their name, say, I'm calling the police. I'm going to Narcan you, because as we'll see in the slides to come, people really would rather not experience that if they can help it. And then if you're still unsure, you can do what's called the sternum rub method, where you take the 4 middle knuckles and rub down the sternum as hard as you can. And it's like with CPR, better to crack a rib and save a life, right, than to lose a life. You want to go pretty hard because you're trying to get a physical response from them. If for whatever reason you can't get to their sternum, top of the lip also works to get that physical reaction. And like even just doing that rather lightly on myself, like it doesn't feel good. So if somebody is responsive, that should bring them out of it. If you have determined that the person has not overdosed, you still want to stay with that person and check on them, because heroin overdoses or opioid overdoses do not happen instantaneously, and people can kind of slip in and out of them. And opioids might stay in your system for upwards of 12 hours, which we'll again see on a future slide. But you want to keep checking to make sure that they're still with you, because they could be fine 1 minute and slip into an overdose the next. So turn people on their sides, keep checking on them, make sure they're okay. Now you have decided this person is overdosed. I'm going to give them a Narcan. You always want to call 911 or prepare to take that person to the ER. Here in our rural communities, we are very lucky to have small police forces that do follow the law. I know that is not the scenario in everywhere across the country, and not every state has the great laws that we have here in Colorado, as we are generally leaders in drug policy movements here in Colorado. But I really encourage people to call 911 or prepare to take them to the ER. And we'll talk about why that is so important in the next slides. But this is just going to talk about exactly how to use your Narcan. And so this little thing is on rescue breathing. If somebody isn't breathing, you can provide CPR if you are trained in that. But I'm not a CPR trainer. I'm a Narcan trainer. So I leave that decision up to the individual, whether or not you want to provide CPR. There's also a slide that we'll talk about in the case of fentanyl overdoses. There may be chest rigidity and rescue breathing would be ineffective. So while this can be an important piece of this, it is not necessarily like the end all be all. Rescue breathing may just be a part of it if you feel comfortable giving rescue breaths and someone is not breathing. Yes, Coreen.
Maggie, what is your take on the heart and what the heart does during an overdose? It is my understanding that the heart does not stop. It's just the repression of the respiratory system. So what is your expertise opinion about, does one need to do chest compressions for the heart, or should we just be focusing on the breath?
That's a great question. And again, I don't feel like my answer is definitive because every situation is unique. But I think that what you're saying is correct, that it is a matter of like your breathing has stopped, your heart hasn't necessarily stopped, right? So I would not necessarily, recommend that chest compressions would be a part of this. And because we might not really know what's going on inside the person. And again, I just kind of like, we really want people to get emergency medical services from trained professionals as part of this. And so it's kind of with the rescue breathing too, I leave it to people's kind of personal comfort level with providing CPR. But I feel like, we don't want to do more damage necessarily if we can avoid it. And it's technically not something that is affecting your heart unless the person is really, really far gone already. And so, I would at most provide rescue breathing in addition to the Narcan, and then just kind of defer to EMS. And that's just my personal comfort level as someone who is trained in first aid and CPR. I still, in this situation, would be like, well, I don't know that this person is having a heart attack. I know that they're overdosing, but so I wouldn't think that that would be a part of this. I think the rescue breathing is an important part of this because it is so often that the person has stopped breathing. Does that answer your question? We may have froze momentarily. Okay. Well, come back to me when you're back and let me know if that answered that question. And I feel like for me, it brought up some more things that we will touch on here in the next slides. Okay, so this is what a box of Narcan looks like. Each one comes with 2 individual Narcan nasal sprays in it. Oh, I think we lost Coreen. All right, that's okay. She'll be back. And inside of each box are these step-by-step instructions. So again, you do not have to remember all of this verbatim. There will be a lot of opportunities to have this information at your disposal when you need to use it. So not only is it right on the outside of the box, but it's also, there's a package inside the box. There's a little insert inside the nasal spray, and all of that will show you how to use the nasal spray. But it's very simple. Sorry, skipping ahead of ourselves. Pretty much, it's just a nasal spray. You don't want to prime it or anything before it is inserted into the person's nose. You ideally want to get the person laying flat on their back, tilt their head back slightly to open up the airways, and then insert your Narcan nasal spray and plunge. From there, you want to put the person on their side and into the recovery position, which involves making a little hand pillow, putting the top leg out to prevent them from rolling onto their stomach, to avoid them aspirating any fluids or choking on any fluids while they're lying on their back, which again is also just a harm reduction tool for anyone who's passed out, whether it's from heroin, alcohol, whatever, to turn them on their side, because often they will choke on vomit or saliva or something like that. And that's what leads to a lot of deaths, like Jimi Hendrix, for example. And then we want to give the person about 2 to 3 minutes to see if they're revived. And if they have still not been revived in that 2 to 3 minutes, we'll flip them back onto their back, tilt their head back again, insert the second dose that comes in your kit into the other nostril, and prime. Like I was saying on the last slide, you want to start by calling 911 and then administering the Narcan. And I'll talk a little bit about how the anecdotal information of using multiple Narcan. I just basically recommend to people keep narking them until EMS shows up. Coreen, I'm sorry we got cut off. Did I answer your question before, or what did you miss?
Thank you very much. The world of virtuality is a trip sometimes. But no, I think you did answer my question. And the reason why I asked that is I get a lot of questions with that when I'm doing in-person events. And I think it's important to just cover, for one's comfortability level.
Absolutely. And I think it's a great question. And, Coreen and I have been doing these trainings together for a little under about a year now. And I feel like every training, there's a new amazing question. And so I am the expert, but that doesn't mean I have all the answers or think of every single possible way that this could play out. So it's always great to have more questions and to expand our answers and to help people feel comfortable with using this. Sorry, my dog is having a spaz moment in the corner, but I think we're okay. Okay. So anyway, so using the Narcan auto pump is super, super simple. But there has been a lot of talk in recent years about needing to use multiple doses. And a lot of that is kind of surrounding the strength of fentanyl, that they're saying you need more and more Narcan. And so these nasal sprays are 4 milligrams of the generic Naloxone in the nasal spray form. And the FDA did just approve an 8 milligram form of the nasal spray because of all of these reports of, I've heard people needing to use as many as 6 or 10 of the nasal sprays. But one kind of interesting caveat to that is I really like to include the injectable naloxones in my training because as a former injection drug user, I feel very comfortable with using the needle. And of course, that might be triggering to some former IV drug users. So again, respecting each person's comfort level, but creating this option of the injectable form because this is going to go straight into your bloodstream. Whereas the Narcan, your nasal passages might be blocked or you might not be breathing at all. And so it's hard to really say, is it that there's not enough of the Narcan drug, or is it that it's just not getting into their system right? Because the naloxone injectable is only 1 milligram, but it can be just as effective as multiple Narcans because it is an IM injection. And so I'm very proud that High Rockies Harm Reduction is one of the only organizations in the Western Slope that's providing injectable naloxone, because this is just very important to me. And I think if you feel comfortable using it, I do believe that the IM is more immediately effective. The Narcan is so popular because it's just so easy to use. And so that's why we see it everywhere. And because it's FDA approved and all that good stuff, right? That the government says it's okay. But this is actually potentially more effective with a much smaller dose. But I've heard of people needing to use multiple injections too. So there's, again, every body is different. Every situation is unique. But this is what the injectable form looks like. It comes in 2 parts. And so to use it, you pop off this purple cap, pop off this yellow cap, and then you'll put it in and twist and it'll thread together. And then you'll take the yellow top off of the syringe and inject it. And it's pretty simple. You want to put it into one of your major muscles to get it in there, which include your shoulder muscle right here in your arm, or I guess that's probably not your shoulder muscle. It's like a delt or something. I don't know. Bicep, something, whatever. But this big muscle on your arm, or the front of your thigh or your butt. Just like if you were getting vaccine or any sort of shot from the doctor's office, Depo-Provera, birth control. It wants to go into one of those big muscles so that you can absorb it into your system really fast. It can absolutely go through clothes, go through pants, and it is a little more complicated to use. Like it takes time. If you're panicking, you might want the Narcan nasal spray because it's just simpler. But I just love to have as many options out there as possible. And just that caveat that a lot of folks are saying it's not so much the strength of the drug as the route of administration. So we will go kind of through all of these issues on the next slides. But again, once you've Narcan somebody, you definitely want to tell them, hey, you overdosed and I Narcaned you. Please don't take any more opioids. And we'll talk about this a lot, but you cannot hurt someone by giving them naloxone, Narcan, same name, different route of administration, right? Because all it is doing is kicking those opioids out of your brain. And so that's exactly why Colorado has all of these liability laws and Good Samaritan laws that protect people to use Narcan, even if it's expired, because it really cannot do anything. But that also kind of creates a problem in our data because often EMS will use it to kind of rule out an opioid overdose. So, for example, if you are just a Good Samaritan who's CPR trained and you just love saving lives and you see somebody passed out on the sidewalk, you can Narcan them and call 911 just to rule that out. That may not be what's going on. You have no idea what they took or what's happening, but the law completely protects you to administer Narcan just to rule that out. But then it kind of messes up our EMS data because not every Narcan given is for a known overdose necessarily. So this is one of the major reasons why people need EMS, emergency medical services, after they are Narcaned. Even if they're revived and they're walking around and everything's fine, they still need to go to the hospital because Narcan itself on the top only lasts for 30 to 90 minutes, whereas other opioids like heroin can last for up to 4 hours. So again, going back to that idea that opioid overdoses are not instantaneous occurrences. They don't just happen and that's it. People can slip in and out of them. So you might Narcan somebody and they are revived, but they might slip back into an overdose in 30 minutes. And again, talking about that strength of fentanyl, even though it has kind of a shorter duration of action, it is so much stronger. And so I've heard stories about people literally being held in the ER for upwards of 48 hours, repeatedly being given Narcan to keep them alive. And so again, I know people, especially in this political climate, can be very hesitant to call 911. In a rural community, you want to call 911 because somebody's going to show up with Narcan. EMS is going to get there. In the city, you don't have to tell them that it's an overdose. You can say, this person is unresponsive. I need EMS. And the police don't have to show up. Here in rural America, the cops show up for everything because they're bored. But in the city, they have other stuff to do usually. And we're kind of in the middle of this movement of substance use issues are not criminal issues, they're behavioral health issues. And so working with police departments that like, yeah, you shouldn't be here for this call. You have nothing to do with this other than the fact that a crime was committed because somebody is using a drug, right? But like, I don't really think about that necessarily as a crime, but anyway, we really need to get them that emergency medical services. And so there are ways to kind of get around having to deal with the police, but still calling 911. And so this is just talking again about that recovery person, how to get somebody from their back onto their side. And again, this is all laid out in those instructions on the Narcan box. So the other reason why we really want to get people emergency medical services after their Narcan is if they are opioid dependent, which not every opioid overdose is going to be someone who is an opioid addict. It can be somebody who is opioid naive, who takes too many pills, or a kid who thinks they're taking a Xanax and it's really fentanyl, which we see all the time. But if they are addicted to opioids, they are going to go into precipitated withdrawal, which basically means immediate, intense withdrawal. Because if you imagine a normal heroin addict or opioid addict, which again, I don't love those words, but we're working on it. They stop using, and it's kind of like they start feeling maybe a little itchy, a little sweaty, a little nauseous, and then it gets worse and worse over time when left untreated. When you're given Narcan, immediately all of those brain receptors get their opioids kicked out. And so you're immediately going into a really intense withdrawal. And so that's part of why we want to give people that a little bit of space in that 2 to 3 minutes while we're waiting to see if that first Narcan dose worked, because there's some concern that people could be potentially violent or combative, but in reality, that's been kind of myth busted, because the physical symptoms of withdrawal are going to be so intense that they're likely not going to really be able to be combative. Yes, that does happen, but people are going to be experiencing nausea, vomiting, chills, sweating, body aches, diarrhea, goosebumps, disorientation, fatigue. They were literally just dead, and now they're alive. So they're going to be a little messed up emotionally, mentally, and physically, and they're in that withdrawal. And so we really want to get them emergency medical services, because they can provide medications to ease those symptoms of withdrawal. And if you wanted, get you started on some medication assisted treatment right there in the hospital. So we again want to tell people, you overdosed, we use Narcan on you, and get them to medical care. If you don't want to call 911, fine, drive them to the ER and have somebody else in the car narking them the whole way there, or whatever. But they need to get emergency medical support. And then this is just a note about fentanyl overdoses. Because fentanyl is so strong, there are some concerns that first responders could potentially be exposed transdermally by touching the person who has had the fentanyl overdose. But again, that has been myth busted. You can't really get that exposure from touching somebody or even from providing CPR. But of course, you can always use a mouth guard, a CPR mouth guard, or even just a face mask to protect yourself from that skin to skin contact. But dermal absorption is unlikely to cause opioid toxicity. Because, I mean, if you think about, like, you're already, if you smoke a drug, it's not getting in your brain as fast as if you inject a drug going straight into your bloodstream. If you touch, even if you were to directly touch fentanyl, even if you were to get high, it's going to go through a lot of layers of skin. And so this is just kind of more like a stigma thing that was myth busted. And then this just goes into the Colorado overdose prevention legislation. So our Good Samaritan laws, which are similar in most blue or purple states. Not all states have these same laws, but they are, at least we know they're here in Colorado and in California and a few other states. So the Good Samaritan law here in Colorado provides immunity from criminal prosecution for personal amounts of drugs, paraphernalia, and even minors in possession or minors intoxicated, if you call 911 to report a known or suspected overdose, stay with the person who has overdosed, and cooperate with police. You can't get charged for paraphernalia or possession. Of course, if you were trespassing and the cops wanted to press charges on you for that, or write a ticket for something else, we all know that sometimes cops do shady stuff. But I can say, at least here in our communities, I know firsthand that the police are following these laws and not really worrying about prosecuting for anything else. They're really just worried about getting that person who's overdosed the life-saving services they need. And then this is just talking to you about the liability protection for Good Samaritans to provide Narcan. The law completely protects people who act in good faith, administering naloxone or Narcan to somebody they believe or suspect may be suffering from an opiate overdose. This law also extends to expired naloxone or Narcan. And basically, like, these laws are all very new because the nasal spray is kind of a newer thing, and it's so easy to use that in the past 5 years or so, we've just seen a total change in how this stuff is dealt with at the legal level. And so there's still a lot of confusion. People always want to know, do you need a certificate to provide Narcan or to do Narcan trainings? And the answer is no. There's no certification process because the laws exist in a super gray way to encourage more and more people to have and use this drug. The the studies in Colorado on naloxone have shown that it doesn't matter if it's expired, it doesn't matter if it's been frozen or unfrozen or whatever, that it still retained about 83% potency after 30 years. Excuse me. So people, of course, want to be sure they're following the letter of the law, and I want to get people, to that level of having what they need to feel comfortable. But in reality, you could have an expired injectable naloxone that was frozen in your car, and it's still going to work, and the law is still going to protect you. With the Narcan, I worry that the route of administration, the nasal spray, can be affected by temperature change. And so that is the one thing that it really says on the box, is to store at room temperature. So in Colorado, I just say never leave it in your car, have it in your purse, bring your purse in with you when you come home at night, or in with you when you go into businesses, just because I worry that maybe if the Narcan froze, it wouldn't spray right. But as far as expiration, it really doesn't matter at all. And then these are the naloxone standing orders. And so this will lead us into how you, as the consumer or just general public person, can access naloxone or Narcan. So in Colorado, the standing order was passed in 2015, saying that anyone can go into a pharmacy basically and get naloxone, because this is designed for third parties to have it, such as friends and family members, employees or volunteers with harm reduction organizations, or first responders, or the individuals at risk themselves. So basically what this does is there's a standing order in the state, so any pharmacist can write a prescription for anyone. And, I really advocate, if you work in a downtown area, if you work at a library, or, a hotel or a restaurant, you definitely have the chance to witness an overdose, both in your clientele and your employees. We are seeing a lot of that. And so this is just, putting that out there so anyone can get it. So there's kind of like three major ways that you can get naloxone in Colorado, either from a pharmacist or a doctor, from a harm reduction organization like Hierarchies Harm Reduction, or a recovery organization like Young People in Recovery in Arapahoe and Jefferson County. And then Harm Reduction Action Center is also out in Denver, and there's lots of syringe programs across the state. The Southern Colorado Harm Reduction Association down in Alamosa, Colorado Health Network, or Access Point, they have locations on the Front Range and in Grand Junction. Or you can get a naloxone standing order for your company. So if you're getting it from your doctor, just ask your doctor to write you a prescription. Going into the pharmacy, you absolutely can get it, but there's a few caveats. First of all, they might not have it. They might be out of it. They might not know what you're talking about, depending on the pharmacist or the pharmacy. It might take a while to get pre-approval from insurance. 93% of insurances do cover the Narcan nasal spray, but without that insurance, these 2-packs are about $130 average. And so if your friend is overdosed in the parking lot and you're like waiting in line at Walgreens, waiting for that pre-approval, that is not like the best way to access an emergency life-saving medication, right? So organizations like Hierarchies Harm Reduction, Young People in Recovery, and harm reduction associations and such across the state and the nation are really working to get this into the hands of people who need it before that emergency situation happens. Every doctor that writes an opiate prescription should write a naloxone prescription, but unless they're like a badass that specializes in this work, like some that we have here in Rifle and Glenwood, they're probably not doing that, right? I've never ever had a doctor do that, and I've been written opioid prescriptions probably like more than once a year on average across my whole lifespan, and never once was Narcan or naloxone mentioned to me. So this is also something we're really working on. Alternatively, you can just go in, to one of our organizations, and we'd be happy to get it to you. We can also mail naloxone and Narcan, is totally legal. So wherever you're at, you can always email me at maggie@hierarchiesharmreduction.com, and I'd be happy to either connect you with a local resource or just mail you supplies, whatever it takes to get you what you need. Although I do like to, if you're in an area with another organization, I always encourage you to go to them. I'm not creating a silo. I'm not the only one doing this work. And then finally, so in Colorado, you can register with the Naloxone Bulk Fund. The easiest way to do that is probably to go to the Colorado Consortium for Prescription Drug Abuse Prevention's website, and they can kind of walk you through that. You can also just Google Colorado Department of Public Health Naloxone Bulk Fund and go to CDPHE's website. You register with the bulk fund. I think it's like a two-step process where you have to, okay, so you register to get your standing orders as an organization, then you register with the bulk fund, and then you can order supplies. Here in rural America, we have a lot of small nonprofits where, I'll give them 2 to 4 kits and hopefully that's all they'll need. And in 2 years, they expire and I'll replace them. But if you want your own box of 12 Narcan, if you feel like your organization can use them or give them out, I really encourage people to go through that process of getting their own standing orders and bulk fund account. I think the one major caveat is if you have like a prescribing authority in your organization, you can't get your own standing orders. I think because theoretically your doctor could just write you a prescription for it. So oddly enough, I actually do supply some medical places. I supply police departments and stuff like that, just because for whatever reason they can't get their own standing order. So that happens from time to time. But again, we're always here to walk you through that process if that's something you're interested in. And then this again is just talking more about that naloxone distribution standing order, that we want everyone to have it. This is a really, really great resource, is the OpiRescue app. And this is amazing to have in a pinch because it will walk you through how to identify an overdose, how to respond, how to use Narcan, everything you have to do. And it also gives you a little like how to find treatment or help in my area. And you can put in your location and it can show you where there are probably, rehabs, where you can get Narcan, where you can get medication assisted treatment. So again, when we talk about treatment, people often commonly think about traditional 12-step rehab, 28 to 90 days. There are lots of other treatments for opioid use disorder and substance use issues in general. One of my favorite things about this app actually is you can report overdose reversals in this app. And we were looking at like the New York's training, and there was all this stuff about mandatory reporting. And again, sometimes things being so gray and vague can be kind of frustrating because we only have data on the overdoses that lead to death that we know of. There's lots of overdoses that happen in a reverse and we don't know about them. So tracking them through this app to me is very important so that we can see how many lives we're actually saving with this medication. And then this is just another, these next few slides are just some more resources. This is the Bring Naloxone Home campaign, which is put on by the Colorado Consortium and just encouraging more people to have Narcan or Naloxone in their homes. Most opioid overdoses happen at home. Most opioid overdoses happen from prescription drugs. Here in Garfield County in 2020, based on our preliminary data, we only had an increase from last year of 1 opioid overdose, when of course the whole nation is, we're going to have all this huge increase in opioid overdoses because of the COVID-19 pandemic and the increase in substance use and increase in stress and anxiety. But I believe that we were able to keep our numbers low in Garfield County because of collaborative efforts to get this medication out there. So snaps to that for sure. But also just creating that awareness that the one increase we had was from prescription drugs. So I might be out there working with our injection drug using community, but who's supporting our prescription drug using community? Because it doesn't feel like their doctors are. So this is just a great awareness page. And then takemedseriously.org, kind of similar, talking about, how to properly dispose of medications. Nearly 224,000 Coloradans misuse prescription drugs each year. So obviously been a lot of changes happening at the federal and state level to try to curb these prescribing rates, but these things still happen for sure. I know in Pickens County, we have a really, really high rate of prescribing opioids to opioid naive people, meaning people who may have never used an opioid or aren't familiar with them. The rate in Pickens County is so much higher than the rest of the state, likely because we have tourists with sports injuries, but that's not explaining the whole picture there. And then this is our contact info for the fabulous Lindsey and Jessica at the consortium. So feel free to reach out to them with any questions about any of this. And then our last few frequently asked questions. So again, naloxone only works on opioids. So it only works on drugs like fentanyl, heroin, Oxycontin, prescription painkillers like that. It won't necessarily reverse and it won't reverse an alcohol or benzodiazepine or stimulant overdose. But again, it won't do anything if there's no opioids, and we don't freaking know what's in people's drugs. We know that there's a lot of bad stuff leading to accidental overdoses. So when in doubt, give them a Narcan shout. I'm working on that rhyme. Stick with me. We'll have a better one next time. And then again, storing naloxone or Narcan, we just want to keep it at room temperature is the number one thing to help it maintain its efficacy. But again, if you have an old nasal spray that's been sitting around in your car, better to try it. It might work. And then these are just some kind of quality assessments on expired naloxone here again, talking about that the quality assessment demonstrates that expired naloxone products may still meet USP standards even after many years. So it's still very safe to use. This is talking about naloxone use in the school setting. The consortium has actually put together an amazing toolkit for schools. Schools absolutely are legal to carry it, absolutely legal to administer it, no liability. I get it. Schools are a little resistant to that because it's a hard world to be in, because it's really the parents that you're dealing with more than the kids, right? But it is totally safe and legal. And so really working on getting that information out there. This just kind of talks again about the Good Samaritan laws and comparisons to other states. So as you can see, California has a lot of immunity, but not immunity for other violations that are not related to drugs. Arkansas, interestingly enough, you don't have paraphernalia immunity if you call 911 for an overdose, but you might have parole immunity. So again, it depends on where you're at. I know we kind of work with a lot of the states in the West Coast, so I just encourage people to find your local laws on this. And again, this is just more, this is for the state access to naloxone. And this is going to be more widespread across the states, that most states are going to have that kind of third party distribution rule and that standing order. They're more likely to have access to Narcan than they are to have criminal protection for people using Narcan. Fancy that. And then people have talked about Narcan as enabling. I actually had the pleasure of being called out in a presentation to our county commissioners recently, where I won't go into all the details. I'll just say I don't care what's happening in cities of 100,000 people in another state. I'm very focused on what's happening in my rural community. And so again, like a lot of the work I do is based on my personal experience growing up in this community, living in the drug use community, and working in the drug use community, and knowing the drug trends of my community. Yes, there are similar trends across the country, but what's happening somewhere else is not necessarily relevant to what's happening. So there was this very sad story about a party in the Midwest where, 6 kids overdosed because the person who was supposed to Narcan everyone also used. That is absolutely a tragedy and a complete misuse of this medication. But it took me a long time to even understand what people's argument was that naloxone could be potentially enabling use. And so that argument is, oh, well, if people think they can use however much they want and just Narcan, that it's not reducing use, right? Well, again, our goal is to keep people alive. And if you have experienced or witnessed an overdose, it is not something that you will intentionally, voluntarily experience again. It is not comfortable. It is not fun. It is very painful. And being Narcan is an excruciating experience if you have opioid use dependence. So while I respect that that happens, that is not an issue of Narcan being enabling. That is an issue of maybe your government or your public health department or your police department is not supporting and advocating for the correct use of this drug. If we refuse to put it out there and be real about this stuff, misuse of drugs like heroin or Narcan or meth or whatever is going to keep happening. We're trying to save people and keep them alive. And personally, I live in a town of 10,000 people. So what happens in a town of 100,000 people or 700,000 people is not relevant to me. But I respect that every community is different and has different community drug trends, but that we're all also experiencing this epidemic together. So I'm not saying that information isn't good. It's just like I work with the police departments here on a regular basis. I know what's going on here on a regular basis and what's working here. So that's great that you talk to a police officer in a town of 100,000 people in the Midwest, but that really is not relevant to me. And that argument for enabling is also not relevant, but it's good to look at what the other sides are. But the point is that there is no empirical evidence to support the concern that take-home naloxone programs might encourage heroin use. People are going to use if we support them and give them love and compassion. That's what makes them less likely to use, not whether or not they're going to live or not, because honestly, at that point, we don't really care if we live or not. And that's why we're injecting drugs. But I will bring it down again and going off in different directions. So finally, people are just concerned. They want to make sure they're using this correctly. They, and in a pinch, if you're not comfortable doing this, just call 911. But multiple studies have shown that just this training alone makes the layperson just as effective at recognizing and responding to an opioid overdose as a medical doctor. So this training is legitimately all you need. You do not need a certificate. All you need is the instructions on the box and you got it. You cannot hurt someone by giving them naloxone. And if they're not suffering from an opioid overdose, the drug does nothing. So that is pretty much it as far as the Narcan training goes. I would love to do a little, we took way longer than usual, which is funny because usually we have questions and stuff. So I'm just being really thorough for our recording today. I would love to just take a couple more minutes to demonstrate how to use fentanyl test strips. But Coreen, any comments, thoughts, parting sentiments?
No, I think Maggie, you definitely touched on some topics that are difficult to define, and especially the stigma surrounding naloxone and Narcan about people just wanting to utilize these to use more. And believe me, people, if you are, and this may be inappropriate, but if you are thinking that way, you are part of the problem. We really need to focus on saving lives. I don't care if it's your 20th overdose, maybe the 21st one, you're going to be ready to get some resources and some assistance. And that, folks, is the goal behind this.
Yeah, thank you so much, Coreen. And yeah, it is a travesty if people are misusing this medication in that way. And it does happen. But again, I'm kind of like leaning towards the sentiment that they might not have people like me and Coreen in their communities. They might not have supportive police departments that are carrying Narcan like we do out here. I don't really know. I don't know where that was that happened. But yeah, I mean, this drug is to save lives, and that's what we're here for. And I will say, like, from my personal perspective, we have kept people alive in our communities who have gone on to carry that with them, because yeah, a lot of the times people will have multiple overdoses. It happens. And maybe that's because they're not getting the support that they need to lift them out of that place. It's like I've been talking a lot with people about child welfare. If mom doesn't have diapers for her baby, she needs support in getting those diapers. It is a very rare mom who's like, yeah, I just don't care that my baby doesn't have clean diapers. Every mother wants clean diapers for her baby. Every mother wants their child to live. Every person wants to be happy. And it's not our fault that for whatever reason, we're so unhappy that we're turning to drugs. And I just believe that in most situations, drug use and addiction are based in trauma, are based in, if you have a million things, worrying about diapers, worrying about rent, worrying about where the next meal is going to come from, it's a lot easier to just worry about where your fix is coming from and just say screw it to everything else. But if you have community community supports that can help you get those things, you'll have less reasons to use and more reasons to give back to society. And so just this year, we saw a situation where somebody was really struggling with their addiction, so much trauma, so much tragedy, both in the past and present, currently going on in that person's life. Of course, they're struggling. They had an overdose. They were revived with Narcan that I provided them from a family member who received this exact same training. And now that person is out there trying to change other people's lives and support other people in recovery. That person might relapse 10 months, years down the road, but the impact that we made in that family's life is so strong, and they want to make that impact in other people's lives. When somebody shows you love and kindness, it is contagious. But when somebody shows you stigma and shame, that is also contagious. And yeah, why would you care about a society that criminalizes you? And this is, I just get really heated about this stuff because that's my experience. And now I've been able to find recovery through harm reduction and through finding stability. Stability in my life has led me to recovery from substances. And so there's a different pathway for everyone, alternative approaches, but that's why I advocate for harm reduction, because that's what saved my life. I love you, Coreen. You're so amazing. So I've also I've been really excited about adding fentanyl testing strips to this training. And so this will just be a couple more extra minutes, but I'm really excited because last month, I was messing around with flour and making mess, and I have a really cool demo for you guys today. So fentanyl test strips are another thing that High Rockies Harm Reduction is the only company in our region providing these. And this is really important because, as we talked about throughout this presentation, fentanyl or carfentanil, which unfortunately I don't think this would test for, and so I'm also working on getting larger panel drug kits, but is presenting in all sorts of drugs and leading to accidental overdoses all the time. And so the one thing is it does depend on what kind of drug you're testing. So if you're testing heroin, cocaine, or benzodiazepines pills, you want to only use a very small amount of water. If you're testing meth or MDMA, you want to use about a half cup of water. But basically, you can test your drugs to see if there is the presence of fentanyl in them. And like I've been saying, one of the biggest things we're seeing is fake Xanax and fake Percocet that's actually fentanyl. And it's a real specific threat to our adolescent communities. Pills are very popular. Drug culture is like all about Xanax these days. And here in our rural communities, we're absolutely seeing fake Percocet and fake Xanax. Eagle County sheriffs have had like 4 drug busts alone this year on the I-70 corridor of like tens of pounds of meth, of fake Percocet that's actually fentanyl, of some really nasty stuff. And so being on the I-70 corridor, we don't know like where the destination necessarily is, but it's definitely in our communities. And so I wanted to today demonstrate how you would test a pill that you're planning to swallow for fentanyl. And so I've put this aspirin into this cellophane. It's just like I was a real world drug user or something. And what I've done is I've just kind of rolled the pill around in there. And you can already see that it's very obviously there's a little bit of debris buildup in there. And so that should be enough. I also say, like, if you're testing cocaine or some other powder drug, you can take your bag that your drugs are in, put your drugs in another bag, and use that bag to test. If you're preparing drugs for injection drug use, you want to cook them up, load your syringe, and then use the residue left in your cooker by putting some water in there. But so imagine that this is my little Xanax baggie. I rolled my pill around in there, and then I'm just gonna add, I should probably get my fentanyl test strip ready first so I'm not spilling stuff. It's been a real clumsy week for me. But so this is what the fentanyl test strip looks like. And you can see that there's this dark blue line with these wavy lines underneath. So this is the portion that we want to get into the liquid and nothing else. Took me a while to learn that. It's all right there. If you read the instructions, it's really simple, but just like in the real world, I did not read the instructions. But so we're gonna put just a little tiny bit, the language is 1/4 inch of water. So we just wanna put a very small amount of water into our plastic bag, kind of swish it up in there a little bit to really get that drug residue off of the sides of the bag. These cigarette cellophanes are really strong, so they're perfect for this. And then we want to dip the end of the test strip in water for 15 seconds. So 1 Mississippi, 2 Mississippi, 3 Mississippi. And then you can already see that it's starting to give us a reaction, that the water is moving down the strip. And so what we're looking for is 2 red lines is negative and 1 red line is positive. So I'm going to put that to the side for a second. But this is that information. So 2 lines is negative, and sometimes the lines can be really, really faint. You might not be able to see them very strongly, but 2 lines still indicates a negative, even if it is very, very faint. And you can already see that I have 2 lines on that. I'm really pleased to know that my expired aspirin does not have fentanyl in it. I didn't think it would, but I really just wanted to demo that for you guys because the pills are one of the biggest risks. And if you're not crushing up or injecting your drugs, sometimes it's like, well, how do I test them? But as long as you have that residue, that's really all we're looking for, is a very small amount of residue with a small amount of water to test your drugs for the presence of fentanyl. And it doesn't mean that you don't have to use them. It just means you only have to use a very small amount and you're going to get just as high as you would with a big old shot of heroin. So again, we just want to open this up so that people can feel trusting and safe to get the help that they need to keep them alive, because the longer they stay alive, the longer they have to achieve stability in their lives and ultimately achieve recovery, whatever that means for them. The model of harm reduction suggests that that's just about quality of life, not about sobriety. And we're really proud at High Rockies Harm Reduction to reflect that in our staff and board. However, we also really support every pathway to recovery, including the 12-step models, including marijuana maintenance, moderation, whatever it takes to get you where you want to be the best you for yourself, your friends, your family, and your community. Thank you guys so much. Coreen, anything else from you on this one?
Maggie, I think you have absolutely covered from A to Z, and I appreciate you to the fullest extent.
Thank you so much, Coreen. I will stop recording and just thank you all so much for watching.